I'd now like to call on Pip Jaffa from Parenting Northern Ireland and Dr. Stella Owens from the Centre for Effective Services, who are going to do a sort of double act, explaining the work of the Parenting Special Interest Group and talking us through the position paper that the group has developed.
Good morning, everybody. I'm delighted to see so many people here today, and looking at the attendance list, it's from a real broad range of sectors, many practitioners from the HSC North and South, and government departments in the North as well. So we're delighted that what we hoped would generate interest has succeeded in doing so. I'm just going to talk to you a bit about the Special Interest Group in the background, and then Pip and I between us are going to talk about specific aspects of the position paper which we developed, which is also in your packs. So the Special Interest Group was established by the Centre for Effective Services in December 2010, and the idea behind it was that we would create a unique space for developing thinking about issues relevant to parents in their parenting role and children and young people's well-being. So it's important that we emphasise that it's supporting parents in their parenting role as opposed to providing other types of supports to parents. We wanted to build bridges between people, groups and agencies and add value to existing work and networks. So I wasn't aware of any particular parenting group that existed previously, and as part of the remit and function of the Centre for Effective Services is to bring groups together that wouldn't normally meet. And those groups who would seem to be quite disconnected and often where there might be potential conflict or tension between the groups. So it was quite a daunting task in the beginning, because we were bringing people together who are from a diverse range of groups who are delivering services. And thankfully, over the last few years, we've actually succeeded in becoming quite a united force. So we brought together people from research, so people that I would have come across in my previous practice, and also those that I would have met through the work of the Centre for Effective Services. Also people from policy, from the policy field. So I would have spoken to people in what was the Office of the Minister for Children and Youth Affairs at the time, just to see about whether there was an interest in the group in the first place. Then obviously bringing people from practice, those who are delivering services on the ground, with the idea of developing what is a community of interest. So we brought together a group of about 25 different organisations, and at the beginning we shared a lot of information. We looked at kind of potentials for the group, opportunities that were around, and the first few meetings were literally that, talking to each other, getting to know each other. And there's often an assumption out there that everyone knows what everyone else is doing, and this is actually not quite the case. So as the group kind of went on and developed, we reckoned that there was potential, because there were such senior members represented in the group, that we could do something more. And one thing that was really evident was a passion. Everybody around the table had a passion around working with parents, working with families, supporting parents, and also all with the intention of trying to improve outcomes for children. So the context in which the group was meeting was, I suppose, where there had been a focus on children and our family in policy and strategy documents. And again, that was both in the North and the South. The approaches to parents, supporting parents, were based on intervening to remedy deficits rather than building on strengths. And there was a clear absence of an explicit parenting strategy in either jurisdiction. And I use the word explicit because the two strategies that have come out in the North and the South, our Children and Young People Are Pledged, and our National Children's Strategy, talked about supporting parents, but this has tended to be kind of permeated throughout the different strategies, but nothing explicitly articulated. In Northern Ireland, there's been the strengthening of the Children and Young People Strategic Partnership in Northern Ireland, so it's bringing together all the government departments and agencies and voluntary groups to improve outcomes for children and young people through more integrated planning and commissioning of services. There's the need to implement our Children and Young People Are Pledged, which is 2006 to 2016. So that is a strategy that is right in the middle of its overall duration and span. And the need to develop further and deliver on the Families Matter strategy. So the Families Matter strategy from 2009 does have parts of it that relate to supporting parents, but again, they're not explicitly or very well articulated. And I am aware that that particular strategy is under review currently. In the south of Ireland, there was the Children's Rights Referendum and amendments to the Irish Constitution. And for many people, there was a perceived impact on parents, particularly in disadvantaged communities. So many of those disadvantaged communities actually voted no. And there was, as I say, a perceived kind of backlash that parents feeling quite vulnerable and under threat in terms of the inclusion of the children's rights. So we have to be very conscious of that, about maybe repairing and rebuilding relationships as service deliverers. Obviously, there was the development of the National Children and Young People's Policy Framework, which in its current iteration doesn't have a specific parenting strategy. And then the establishment of the new Child and Family Agency and its accompanying National Service Delivery Framework, which again will impact on all of us delivering services. So what we decided to do was is to put our combined wisdom and collective knowledge and experience together and to put forward this position paper. And we wanted something that was going to be short and succinct, but that was bringing together all of the messages and the international research and information that we're all very familiar with, and all of you are very familiar with. And as one does, one has to articulate a vision in a position paper. And our vision was that the island of Ireland will actively value and support parents in their parenting role to achieve better outcomes for children, parents and families. And it was also important as well that there is an emphasis on improving outcomes for children. But it's not just about children, it is about parents as well, so improving things and situations for parents. So why does parenting matter? Well, all of our organisations were undertaking different type of service delivery. We were engaged in evaluation work about a lot of the programmes and services that were part of the prevention early intervention, for instance, and also the kind of services that have been provided by the Health and Social Care Trust in the north and the HSE in the south over many years. But there was a consensus about what the key messages were in relation to the research. And we've kind of tried to highlight that in the position paper, the key ones, which, as I said previously, you already know. So the quality of parenting influences outcomes for children and young people, and therefore there's a need to plan services which will empower parents to maximise their parenting knowledge and skills. The quality of the parent-child relationship is associated with a number of outcomes, including self-regulation and behaviour, engagement and participation, mental health, academic achievement, and the ability to develop and sustain other relationships over a lifetime. A negative parenting style is strongly associated with aggressive behaviour, delinquency, depression, anxiety, and high-risk behaviours, for example, smoking and drug and alcohol abuse. A supportive home learning environment is positively associated with children's early achievements and well-being and influences social mobility. Warm, attentive, stimulating parenting is strongly associated with children's positive social, emotional, cognitive and physical development. So all these messages are very familiar. You've heard them over and over again, but it's about highlighting them in terms of the consistency. Children who have benefited from good parenting have a greater chance of succeeding in school, of getting jobs, and reducing the chance of engaging in criminal behaviour. Parenting is an important mediator in redressing the effects of poverty and disadvantage. Parents are key mediators in developing and supporting desirable health-related behaviours among children and addressing undesirable behaviours. And as we know, with the increasing rise in childhood obesity across the island, there is a need to mobilise parents as a key factor in this and to address the problem immediately. And finally, changes in the family only occur if we empower parents, and making decisions on their behalf will not have long-term benefits. So parents need to be motivated and actively involved, and therefore parental support needs to embrace the principle that positive parenting must be mutually beneficial both to parents and to their children. Okay. I'm going to hand over to Pip.
Morning everybody. I'm just going to continue with what is said in the position paper. So Clearly, we've had a lot of parenting approaches and parenting programmes which have been delivered, and they've grown up to address all sorts of issues. Some of them are age-focused, some of them are issue-based, some of them are universal, some of them are targeted. Some directly aimed at improving outcomes for children, and some directly aimed at improving outcomes for parents. But what we're calling for in the position paper is that whatever the nature of the programme or approach, it should be evidence-based. And that would be strategically applied, because we know that they achieve the best outcomes for children. Not only do they achieve the best outcomes for children, but they give the greatest possible social and economic return. And I think we all know that at times of financial constraints, using the most effective intervention is even more important. Equally important to what programmes we use, we have the international context of parenting there, and there is no doubt that there is an obligation on state parties to support parents, given the clear statements in the articles of the United Nations Conventions on the Rights of the Child, signed by all countries except USA and Somalia. So we know that the articles set out the minimum standards, and in Article 5 it's very clear that government should respect the rights and responsibilities of parents to direct and guide their children, so that as they grow they learn to use their rights properly. And in Article 9 it says the rights of a child should stay in contact with their parent in the circumstances when the couple are separated. And implicit in these articles is the need for states to have policies in place which will enable states to fulfil the commitments in these articles. So, when we're talking about how parenting support is delivered, I've talked about the need for evidence-based, but equally significant to determine good outcomes for children is how programmes and approaches are implemented. If we're talking specifically about programmes, they should be underpinned by evidence and implemented with rigour. They should have a theoretical base, and they should have trained facilitators, as well as those facilitators being monitored to ensure they keep to the fidelity of the programme. If we're talking about approaches and practice, those people who are delivering whatever the programme or project is, it should be done by trained workers. And those trained workers should know, for example, how to engage with their client group in the best possible way to optimise their continued engagement in the project, and they should take account of both contextual and cultural nuances. So, what do we mean by parenting support? The emphasis for the Coalition on the Special Interest Group on Parenting is to promote support for parents in their parenting role. And let's be clear what we mean by that. We're using Professor Mary Daly's definition, and what Mary's saying, parenting support refers to a range of information, support, education, training and counselling, and other measures or services that focus on influencing how parents understand and carry out their parenting role. And I'm sure for those of us who are working in parenting support, it's very helpful to have a very clear definition what we mean. But the overall aim of parenting support is to empower parents and enhance their skills and knowledge. More specifically, parenting support should embrace practice, approaches and services and interventions that empower parents by developing parent confidence and competence, enabling parents to foster optimal child well-being and developmental outcomes. And one of the key outcomes should be to increase enjoyment and satisfaction of parenting, something that I think is often forgotten, yet it is so important that we make sure parents do enjoy bringing up their children. The benefits. And the benefits for parents, Stella has referred to the positive and negative outcomes on children depending on the quality of parenting. But Deborah Gatti very succinctly quantified the benefits of parenting support under parents, children and society. And I think it's very clear to see that there are multiple benefits for parents: family relationships, better mental and emotional health, more participation in the community, more knowledgeable about their child's development, better home learning environment, increased understanding of the importance of play and interaction and their children. And I think those of you who are delivering parenting support, I hope that resonates very much with you. For the children, better child parenting bonding and attachment, better social, emotional and cognitive outcomes, better health outcomes, reduction in child obesity as one example, a very big problem for us here, better self-identity and self-esteem, so important for their mental health and well-being, better resilience and school readiness, better outcomes in later life across a range of psychosocial dimensions. Very clear outcomes for the children. And overall, for society, reduction in social costs, effective use of resources, productive, well-educated workforce, reduction of inequalities, promoting active citizenship, developing human and social capital, and improving cross-departmental and cross-sectoral cooperation. So I think when we look at that range of benefits for parents, children and society, I don't think anybody could be left in any doubt that supporting parents is a must. Thank you.
So in our position paper, we tried to articulate what we would like to see happening from various different perspectives. So the first thing is in terms of a policy commitment and a widespread recognition that parenting support should be seen as normal. So this is about supporting parents at a universal level, and it shouldn't be seen as a failure on behalf of parents when they are requiring assistance and support. This should be part of normal service delivery. A higher value placed on parenting, with parenting a recognised issue on the national policy agendas in both jurisdictions. And a widespread recognition also that the state has a role in supporting parents. In terms of a strategic approach, the primary thing that we're asking for is a resourced national parenting policy framework or strategy, for example, like that launched last year in Scotland. And I'm hoping Marion's going to speak very loudly to that as well, and without focusing too much on the negative consequences thus far. So that's really what we're asking for in the context of maybe the revision of the Families Matter strategy and the new developing National Children and Young People's Policy Framework, that there will be a standalone parenting strategy. A coordinated approach to ensure that parenting support services are available to all families who want or need them through a combination of universal and targeted supports. Specific actions, well, as Pip has spoken about and the messages have clearly indicated, that there needs to be a focus on evidence to support effectiveness of programmes and practice, and to use that to inform future servicing commissioning. So we know that the work of the Children and Young People Strategic Partnership and also the work of the new developing Child and Family Agency is going to be very dependent on the use of evidence to support the commissioning of services. We're also asking for a quality framework or standards for all practitioners and services delivering child parenting and family services. So here we're talking about children's workforce development. So all of those in the workforce, whether it's public health nurses, childcare workers, social workers, speech and language therapists, all of those who are providing services to children should adhere to quality standards. And we are beginning to do some work with the Health and Social Care Board in the North about working together to address that issue and to put something together in relation to a quality framework. As the Minister mentioned, there is a need for cross-sectoral and cross-departmental cooperation and collaboration between parenting programmes and supports and the health services, early years, community development, youth services and family and educational supports. So we're really talking about justice, education, health and children, And it's quite a kind of a rhetoric that we get into in relation to the need for the departments to work together, but it's absolutely essential. And we know from, again, from research that if where that doesn't exist, and cooperation and kind of interagency, interdisciplinary and interdepartmental working is absent, that service provision doesn't work. So, thank you.